Thank you. I want to bring this conversation back to where I think it belongs, and that's with the people that we are all here to represent. Secretary Kennedy, while you're here, your boss is en route to my district in Las Vegas, trying to rebrand the One Big Beautiful Bill. But back home, my constituents aren't buying what President Trump is trying to sell, because they're living the real-life consequences of higher cost, less certainty, and real fear about losing their coverage and their access to care. During the majority's field hearing in Las Vegas last year, they shut out the public and brought in a paid actor. I took a different approach. I invited my constituents to share their real stories about what these healthcare cuts would actually mean for them. And what I heard wasn't a matter of politics, but rather of survival. One of those constituents is Deja, a mother of a medically complex child, Shay. Shay was born at 30 weeks. He spent 3 months in the NICU and came home on an oxygen and feeding tube, one he still depends on to survive today. He needs in-home nursing, specialist, and ongoing care, all made possible by Medicaid. Without it, his family would face inaccessible costs and copays, leaving Shay at risk of failing to thrive. I've also heard from another constituent, Richard, who told me that at the beginning of this year, his marketplace premiums went up $1,700 a month. He said he and his wife are effectively out of the economy. They don't go out. They don't get to go to restaurants. There's no discretionary spending because they're just trying to make sure that he has access to care. So families like Deja's and Richard's, to them, the healthcare affordability crisis is real and it's urgent. So let me bring it back to the basics: cost and coverage. What are you doing right now, Mr. Secretary, to lower premiums and to protect coverage for families like Deja's and Richard's?
Well, first of all, I would say, Congressman, there are no cuts to Medicaid. You look at the congressional...
What are you doing, Mr. Secretary? That's my question is, what are you doing right now? What are your priorities to reduce cost and ensure coverage for the American people?
Well, we negotiated the lowest drug prices in history. And we're implementing those now with the MFN. This is one of many things that
And how does that address coverage?
Well, in terms of insurance coverage, we're doing many, many things within the agency. We are, President Trump is right now with his...
What are you doing? You're the Secretary of Health and Human Services. Reclaiming my time. I'm asking about tangible actions and results. To me, the fact that you can't answer a basic question like bringing down cost and coverage, which should be your top priority, not some podcast, but actually addressing the needs of people. Now, like others, I want to make America healthy. I agree with the goal of moving from a sick care system to a true health care system focused on prevention. And prevention starts with the basics: clean air, clean water, and reducing exposures to toxins. So I'm struggling to reconcile the reports that some at EPA are working to roll back protections that would increase exposure to heavy metals in drinking water, arsenic, lead, mercury, and chromium. These are toxins linked to cancer, to heart disease, to stroke, and permanent brain damage in children. So just one question: were you consulted on those efforts to roll back those EPA protections? Yes or no?
No, I haven't been, but I'm happy to talk to you right now about a long list of things that we're doing to roll back insurance premiums. And I would begin that with skin substitutes. Our reform on that is reducing premiums in Medicare by 6% this year.
Have you aligned your goals dealing with the reforms to the EPA protections and how that is making people sicker, not healthier? That was my question.
Yeah, I could not answer those questions because it's
You
not in
can't
my...
answer the question as the
on my,
secretary.
it's not my agency.
You don't coordinate with the EPA, Mr. Secretary? Your department is not involved with rolling back protections that would increase exposure to heavy materials, even though it affects people's health? Is that what you're telling me? You don't coordinate?
I say, calm down, Congressman.
Don't tell
And the
me,
answer-
look,
the
healthcare is
answer-
personal
Okay.
to my constituents like Deja
Your
and
time
Richard.
is over.
Do not tell me to calm down. Healthcare is real. And if you
yeah,
can't answer basic questions, then maybe come prepared next time.
I'm answering the question. You don't give me the chance to answer. You haven't given me a chance to
You
answer.
said you
I'm happy
didn't-
to answer your
you said
question.
you
And
weren't
cut me off when I started to answer.
You said you
You started screaming
not
at
consult-
me.
Okay, the
with
time has
EPA.
expired. We're going to move on. Mr.
People
Yocum.
scream when they don't have much to say.
You obviously don't have anything to say because you can't even uphold what it is you're
Say it.
doing to
Mr.
reduce
Horsford,
cost
your 2
and
minutes
coverage.
over.
Give me a chance